Next, we'll turn our focus to closer to home care. ThedaCare serves 17 counties across Northeast and Central Wisconsin with many rural areas. And we know that rural residents have different needs and their own challenges that we need to address. And ThedaCare believes someone living in a town of 200 should have the same access to care as a person living in a city of 200,000. And that dedication led us to pursue and complete the expansion of the emergency department here at ThedaCare Medical Center-Berlin just 2 years ago, celebrating our 2-year anniversary this July. Tammy Bending is the Vice President of Critical Access Operations at ThedaCare Medical Centers-Berlin and Wild Rose. Tammy, welcome. Thanks for being with us.
Thank you. Thanks for having me.
So we're talking about this expansion project here in the ED, 2-year anniversary. What was that project like and what was the need for that?
So it was really important to the community that we be able to invest in our community, our commitment to the community, and having emergency medical care here, keeping that local. We needed a state-of-the-art facility. Our former area, we weren't going to be able to grow, and of course, growth is what we want to do, but we also want to bring it to a modern era. So very important for our communities to be able to continue to access us in a modern setting.
And like we were talking about, rural areas have kind of a different need than other areas that we might serve. Can you tell us a little bit about how this area in the ED was designed to fit the needs of this community?
Absolutely. We have a lot of agriculture here, a lot of companies that use chemicals, and the reality of having a chemical spill or somebody being exposed to chemicals is real. So to be prepared for that, we put in a decontamination room here. And that way people are able to come inside, be decontaminated inside, and then go into the emergency department. Formerly, we had to have a tent that we set up outside, and as you know, Wisconsin winters are not friendly. So whether it be 30 below or 80 degrees, we would have had to set up a tent for decontamination. So that's been really important for us. The expansion of our garage, our former garage, patients were in the elements. We had to either open doors to get them out depending upon what the day was like, or our rigs had to move forward and also be in the elements to be able to get a patient in. Now they're inside and we have 2 rigs. One of the other things too is our view of our patients. It's really important for our staff to be able to see what's going on in patients' room for their safety. And with this new design, they're able to do that. As you know, Cass, behavioral health isn't just limited to rural health. And as we see an increase in behavioral health, we looked at how do we keep those patients safe. So we did implement 2 behavioral health rooms. Everything in the room is set up so those patients are safe. If they're having a crisis, they're safe and they're able to be taken care of here until we're able to get them to a even safer area.
Again, all small pieces and updates that were really needed for this space.
Absolutely.
Now, our rural hospitals, they play such an important role in the overall ThedaCare organization. Our critical access hospitals allow people to get care close to home, and when they need maybe more comprehensive care, they're connected to the regional medical centers in the larger locations. Can you talk about how important that is to be able to have something like this available here and be connected to a larger system?
Extremely important. Our community can come to our local hospital. They don't have to drive further. And if they need more comprehensive care, we're able to get them there immediately. We have definite protocols. People who may be having some type of serious crisis, we can get them. We have a great relationship with our Nina and our Appleton hospitals. So patients can come here and don't have to think about, boy, I need to bypass because I'm not going to get that care. Berlin is also, along with our other rural hospitals, is stroke certified now. And we're very, very proud of that and able to stabilize those patients who might be having a stroke event and get them to our regional hospitals.
All right, Tammy, thanks so much for being with us.
You're welcome. Thanks for having me.